not care where you hide, and you will never be rid of me. Why so thirsty? I don't care how much you drink.
How are you today?
Good. How are you?
Really good. Okay, I'm going to have you sit back. And let's just talk about why you're here today.
I have a really dry mouth, and I'm not sure what's causing it, but I do breathe out of my mouth all the time.
Really? So does your mouth usually feel dry?
Yes, it usually feels really dry, and it actually keeps me up some nights.
Do you find yourself getting out of bed at night, trying to drink some water and keeping your mouth moist?
Yes, I actually get up all the time in the middle of the night, and I lose sleep from getting water.
So are you on any medications that you take daily?
Yes, I am on medication for my acne.
Oh no, not the hygienist, my mortal nemesis.
So what it sounds like to me is that you have a condition called dry mouth, or we like to call Xerostomia. I actually have some information here for us both to read. So dry mouth actually affects up to 29% of adults, and it's not just a discomforting annoyance. Patients with dry mouth are at an increased risk of cavities, maybe up to 3 times the greater risk than the average person.
Wow.
Yeah, so I'm glad that you brought this to our attention. It can even cause periodontal disease and maybe even mouth infections. And if you turn this over, there are a lot of patients who are on specific medications, one of which that you said you were on for acne, that can cause xerostomia. You also mentioned earlier that you are a mouth breather. You breathe a lot out of your mouth even during your sleep. That's another huge cause of xerostomia. A lot of things that we like to recommend for our patients are things such as biotin. It's an over-the-counter product.
No, not biotin.
They have a similar pH to natural saliva, so you can go up to the store and just pick it up and use it as a daily rinse. That's one of your options. They even have like a saliva stimulating gum that you could chew on a daily basis. That'll probably help a lot with your dry mouth, Olivia. So if you find that the biotin isn't working as much as you would like it to, there are other things you could do, such as keeping a vaporizer in your room while you're sleeping. And it'll moisten up the air in the room. That way maybe you won't have to get up so many times to have a drink of water. Another thing you could do is just try to breathe out of your nose as much as possible. Just like that. Yep, perfect. Do you have any questions today?
No, I think you answered everything really good.
Good.
And breathing out of my nose really helps.
Good, I'm glad. Yeah, just keep working on that, okay? Maybe even drink some water on your free time.
Biotin.
Number 1, dentists and pharmacists recommended brand for dry mouth.
Xerostomia.